Loading. Options button.
I was always upset, always, and I never needed a reason. I was always sad.
I was angry at myself, and I was angry at the person who I was.
It's pretty sad. You feel like there's no one there for you.
I always felt just very alone. There was no one to trust, no one to talk to, feeling like I was on the outside looking in all the time.
It's not unusual for teens to experience emotional ups and downs while they are growing up, but some teens may develop a deep depression that needs to be recognized and treated. Teenage depression is a deep state of unhappiness and despair that stays with the teen for a significant amount of time and affects the child's ability to behave normally. During this stage of life, teens' bodies and minds are going through tremendous growth and changes. They are dealing for the first time with a host of new situations, experiences, and problems with stressors, socially, sexually, academically, and environmentally. The human brain doesn't fully develop until the age of 25. Emotions and stress are magnified during this period of development.
Well, adolescence is fun, and it's a time of growing and learning and lots of opportunities. But if you really are not able to see those things, and it's always negative and always down, and I don't like myself, and you're looking in the mirror and you're hating what you're seeing all the time, and you're just never happy with yourself, which leads you often not to be often happy with other people, it's a very good chance that you have depression, and you really don't have to feel that way.
Amelia went through the highly stressful events of her parents' divorce, moving to a new state and new school. A history of depression and mental illness in her family put her at a higher risk of suffering from depression.
It really isn't like anything else. It's just this all-consuming, sadness and, boredness and not wanting to ever do anything and just hating everything for no reason.
Amaris grew up in an unforgiving urban environment where the potential to fall into drugs, crime, and violent behavior were ever present.
I was failing all my classes, I was feeling down. And it's not something that you always know. It's not something that you always, you know what's wrong with you. You don't know. You just don't know why you're feeling this way.
Vlad came to the United States from Russia as a young boy. The experience made him very aware of being an outsider. He was frequently bullied, and he began to have periods of depression.
It just felt really lonely. It's something being depressed is such a severe feeling that you just don't know what to do anymore. You're stuck in one spot, and it's just you have nobody.
Elise had severe mood swings and emotional problems since childhood. As she grew older, she took more control of her situation and ended up seeing several therapists and counselors, eventually deciding to make drugs a part of her therapy.
It was so much easier not to care and just kind of go through life and have I would have this flat affect and just sort of this apathy, and I just couldn't care. I just went on and just whatever happened because it hurt too much to even think about what I was going through.
We all get the blues at some point, and a lot of times we can identify what those blues are. We failed a test and we feel really crappy about that, or we just had a fight with our folks, or they told us we can't have this, or we're in some type of trouble. But if you cannot really identify a specific stressor like that, and you have this constant mood that's really getting in the way of you getting things, you just may have a depression. And the most concerning symptom, of course, for some people, particularly if it's prolonged and they don't get help, is thoughts of thinking life's not worth living and having thoughts of one wanting to end their life, which is a very serious, obviously serious symptom of depression.
Symptoms of depression can include changes in eating and sleeping habits, significant weight gain or loss, poor school performance, isolation, violent acting out, feelings of unimportance, irritability and mood swings, feelings of futility, anger, rage, and anxiety, lack of enthusiasm, drug and alcohol abuse, suicidal thoughts. About 4 to 5% of teens in the United States have had a serious episode of depression. Girls are twice as likely to become depressed than boys. The ratio continues into adulthood.
Very frequently there's a lot of anger, angry acting out. Another way of looking at depression that we see in teens is anger turned on oneself, which has an impact on self-esteem, their ability to function in school, peer relationships that may be suffering, a lot of conflict with parents.
I was having problems on the inside, so I wanted to fight someone to just get out my anger, you know?
Things that they usually enjoy, they don't enjoy anymore. It's that they would start staying more and more to themselves and becoming more like a couch potato, like feeling they don't even have the energy, they just want to zone out and stare at the TV. The other thing they noticed, they got into fights more, like feeling more irritable, cranky, even with their closest friends could say like a very simple thing and they would all fly off the handle and their friend would be like, whoa, what's going on here? And feeling they can't control their emotions as well. And some young people will notice that they can't sleep as well. They're either sleeping too much or not sleeping enough. And then some young people will experience a change in their appetite. Either they notice that they're losing weight because they just have no interest in food, or they're actually gaining weight. They're overeating than what they normally do. And young people will notice these changes, and they might be afraid to tell somebody or to even let their parents know. Or, so oftentimes parents might be noticing it but don't know what to make of it. And it may take them some time to actually, feel that they could ask somebody for help with that.
Recognizing depression in teens can be difficult because the emotions and moods associated with teen depression are also very typical behaviors for adolescents in general.
She was very involved in school, in her Girl Scouts, with the family and everything. We just thought she was just real moody. Really, really moody and emotional because she was a perfectionist.
They just saw it as anger, as me growing up, as me being, that age, and it wasn't anything more.
Going through junior high school and high school, I was always an overweight girl, and I was always, cast out as, oh, she's always angry, she's so mean, she's a bully, she's this, she's that, and I just became, by myself.
And I couldn't speak any English, so that was pretty hard for me. Nobody wants to be my friend. It was like rough. It was so bad.
Just something would, I guess, annoy me and bother me, and I would just get consumed by that, and I would just get very, very upset over a little thing, and then I would have to, run up to my room and be alone.
This is where you'd come to walk with your friends. Strange child.
There are a lot of people that have different thoughts about where depression comes from and where it originates. And probably the reality is it has many different types of potential beginning. It's a very complicated interplay between what your genetics are, to what your environment is, what kind of stress. Do you have a safe environment, or are you in a very difficult environment where there's a lot of screaming, fighting, people getting hit or harmed? It's really going to impact the brain and how that person feels.
One of the first things that I look for is their experience of loss, because that's essentially what depression is about.
Maybe mom and dad are having marital problems, maybe the family's just moved, maybe they've been moved into a new school.
Death of a loved one, death of a parent. I have a case where it's the death of a child. So that the kind of suffering over that issue would be evident.
Another possibility is you're born to parents who already themselves had a history of depression. So you may be at what we call a genetic risk for depression. Doesn't necessarily mean you're going to develop it, but you may have an actual risk for it, and maybe again, if certain stressful events occur and things happen, it may actually trigger the depression.
Some things that may trigger depression: any major loss, including death of a loved one, breakup with boyfriend or girlfriend, falling out with friends, moving, divorce of parents, biological changes, drug and alcohol abuse, genetics, illness, bullying, stressful environment.
Environmental issues are a critical factor in assessing a youngster's emotional state.
And growing up in the projects, you always see kids, not going to school or whatnot, or, not working, not doing the right thing, smoking, doing drugs, partying, drinking, different kind of stuff like that.
Licks and the friends you hang around with are a key factor in influencing teens' behavior and emotions.
I had a lot of troubles with friends and that sort of thing, just that compounded that whole experience and that depression. And I think I just felt a lot of pressure to be the perfect student, to, get hundreds on all my homework, and all my tests. I got a 97 on my science final, and that was a bad thing.
You know how they say a girl may make you or they can break you. So she kind of did both of it. In the beginning, everything was beautiful, it was great. She actually made me the person I was. When we broke it off, I was so depressed that it took me over maybe a year and a half to actually date somebody else or even think about kissing another girl.
Amelia's depression was triggered by a falling out with a clique of friends she thought cared about her, but it turned out they didn't.
There is, and I guess it was sort of just dawning this whole emo thing where it's like, ooh, look, I cut myself last night and took pictures. Isn't it so cool? I hate my life. The very first time, that's almost why I started cutting, because it was these guys and their whole aura and their whole scene.
Negative coping mechanisms: isolation, drug and alcohol abuse, eating disorders, self-injury, cutting, aggressive behaviors, sexual promiscuity, risky behaviors and reckless acts, criminal behavior.
Yeah, I definitely think that cutting is addictive in a way, because it's like whenever something like this happens, you think, oh, I have to cut. I want to cut right now. And it's like sitting around like in public and like just thinking about it and like envisioning it almost as badly as like if you were actually cutting. Instinctually, you know that it's wrong. You don't damage yourself. And like that really made me realize like, wow, this is pretty messed up. But that never stopped me from, doing it.
It was the cutting that alerted people to there being a problem. Although it was actually teachers that were concerned about me being depressed all the time and sort of making comments about not being worth it or alluding to different things that made them realize something's going on.
My life was basically fighting to survive, fighting because, because I'm angry, fighting because you looked at me a certain way, fighting because I was young and I was silly and I thought that's how you make friends. But that's another part of, being on the brink of depression, because it's like you are so angry and you want to make friends so bad, and it's like you'll do anything to be, to have a companion, to be friends with someone.
I had nobody here. All my best friends were back in my old country, so when I came here, it's too depressing for me to think of doing anything. And if I didn't do it, I'd probably be home alone. I'd just watch TV. I don't want to go to school.
Physical exercise causes the creation of endorphins and serotonin, which can turn your mood around and help you deal with stress. Proper diet also keeps you healthier and less prone to illness.
So, martial arts actually helped me out. It's actually like an antidepressant. It's not a pill, but it's a thrive. It's like you want to do it. Whenever I'm around here, it's like a community place. Everyone knows everyone. If they don't know you, they'll get to know you. And all the kids, they come in depressed, But when they come out, they're all happy. They don't want to leave because all they do is have fun, they make new friends, and all they do is just run.
Creative expression, music, dance, art, writing all stimulate the mind and are positive ways to express feelings and emotions.
Well, I really, really love theater. So whenever I'd get really upset, I'd start blasting my show tunes and sing. And to this day, I mean, when I have a bad day, I'll, put my show tunes on in the car and just sing. And I'm sure everyone thinks I'm absolutely ridiculous because I am, like singing my heart out, and it's completely obvious to everyone else, but I don't care because it makes me happy.
Writing and poetry helps me because the way that I've always felt about it is because I have always been very able to express myself with writing, and it's just something that came naturally to me. And when it came to writing poetry, especially at this period in time, I had a very good teacher in language arts class, and she sort of got me into writing, like thinking that my poetry was good.
We got about 15 other girls to dance with us, so it was a big dance group, a really, really big dance group. And after that, people knew that I can dance. Like, I was a big girl, but I knew how to dance. I knew how to organize different events and everything like that. And we were going here, going there, and that's where I really knew that, you know what, I'm really getting my confidence back.
Untreated depression can potentially lead to problems later in life that affect you socially, professionally, economically, and emotionally.
Depression untreated with a teenager tends to stay with them. They get stuck.
A lot of ways that a young person should be growing as a person and developing themselves for the future, they lose some what we call milestones or some steps to that if they're in the middle of a depression for that long a period of time.
Because I think even when kids are depressed, or anyone's depressed, it's like you don't realize it, it's just like, this is just how I am, that's just how things are. But it's like, no, that's not how things are. It's not normal, it's not healthy. And when it gets to a point where like you're gonna die practically, and almost realistically, it's like, do something, So, I was afraid. I was afraid for myself, of myself.
Something in your mind shook and said, you know what, I want to leave this earth. And that's a bad feeling. And I just was like, you know what? I gotta leave. I don't feel like being here anymore, because this world is not kind. It's not kind to anyone.
So suicide was, it did tab me a little bit, but I had a lot of friends that actually helped me out with this. So every time I'd feel really depressed, out of nowhere my friend would just call me, and he'll be like, what are you doing?
Sometimes I think I was at rock bottom for a long, long time and didn't know it. But I remember there were so many times that I'd be in my room, the door closed, and I'd just be crying and sobbing on the floor, just thinking, I don't think this can get any worse. And then of course a couple days later, it would be worse.
If you're having those kind of thoughts, it's really important to tell somebody that you trust and that you know, because there can be help to really stop feeling that way and make those symptoms go away. And the other thing that can be really hard for young people is that you may have a really close friend, or your best friend may actually be saying these things to you, that they're feeling so horrible, they don't think life's worth it, and they want to kill themselves. And they might even say to you, you can't tell anybody. Please don't tell anybody. This is our secret. You can't tell. If you're really my friend, you can't tell anybody. And I have had young people who come into my office who said, I'm really worried about my friend. And I have to tell them, I know that keeping someone's confidence is so important, but more important is that your friend stays alive.
Kids don't want to talk to anyone because they feel like if they're talking to somebody, that person's thinking they're crazy. Or that person is just here to, to figure out what's wrong with you. Like, you don't know what's wrong with me? Why are you asking me these questions? Why are you here? Why are you in my face? Get away from me. I want to be alone. Leave me alone. All of that is just like, please help me. Please, I want to be helped. Can you please understand what I'm going through? That's what they're saying. Every time when they say leave you alone, it's please help me.
And when I started to have suicidal thoughts, I knew that wasn't an option, and I had to say, get me some help. And outpatient wasn't enough, get me some help and get it quick.
When the whole suicidal thing came up, it was like, okay. For me, it was like, okay, I'm gonna have to start letting these people help me now because it's a scary thing to think about.
After Amelia's mother discovered her cutting, they sought help from family services and found a program that seemed right for Amelia.
The first thing to do really is to talk to somebody about it. You don't have to carry it around by yourself. You're not alone. And what you're going through is not unique to you. Many of your peers are going through the same thing.
It really is the clinician that you're seeing. The young person's really got to be comfortable with who they're seeing, that they're going to be honest, that they're going to really feel that they can tell this person what's really going on in the inside. I think for teenagers, a big thing is feeling some isolation, maybe not feeling like you know who you can turn to for help, or who's the person you can trust to be able to talk about getting help, or maybe not even knowing how to ask for help.
Really wasn't until she came to us and said, "Mom, I need help." She said, I can't handle this anymore.
In general, what I like to do is have the adolescent and the parent together, if the adolescent, of course, is consenting and willing to come in. And I like to start with both of them in the room together, just so I can hear from both their perspectives what they think is going on.
For many depressed teens, very little therapy or intervention is needed. They will get better just by talking about their problems, giving their histories, saying what's going on in their minds, and discussing their lives with their parents.
All treatments have to be tailored to the young person's needs, so it's really based on that person. I usually like to see an adolescent at least 2 times, if not 3 times, if I can, before I will make the diagnosis. And a lot has to do with just checking all things out to see if there's any anxiety symptoms and some other types of diagnoses that can kind of look like depression, etc. So we really want to make sure we tease out all the things and make sure I know what's all going on in their life and whether they're using any kind of substances like alcohol or marijuana or any other types of drugs. Certainly can impact somebody's mood or their performance at school. So that is one recommendation I will make, is a form of psychotherapy. And again, I'll educate the parent and the young person about what the different types are. There's interpersonal psychotherapy, there's cognitive behavioral therapy, there's also family therapy with adolescents and their parents, and then there's the option, of course, of medications, which I generally reserve more to the moderate to the severe.
Cognitive behavioral therapy and interpersonal therapy are both effective ways of treating teen depression. The problem is that there are very few people that are trained to do these therapies with adolescents. In many parts of the country, there are none.
Cognitive behavioral therapy is a form of psychotherapy where you work with someone who tries to identify the type of thoughts you have, cognition, so the negative thinking that you have. One technique is to say, you have this thought, what's the evidence in your life that supports that thought is accurate, and what's the evidence that shows that it's not accurate? So it's cognitive tied with behavioral. So you have trying to turn around the negative cognitions, and then how do you change the behaviors? The therapist will work to get them to try to do very positive types of activities. And there are studies that show by just getting somebody with depression to do positive activities actually helps lift some of the depressive symptoms.
With kids who may not do a lot of thinking, may do a lot of acting, the behavioral piece will focus on the conduct. Well, if you fight, if you hit, if you curse, if you whatever, there are going to be consequences. So we have to work on changing that behavior.
Cognitive behavioral therapy can be a confrontational therapy in that it challenges the adolescent to correct their behavior and way of thinking. Not all teens can handle this type of argumentative therapy.
Before 10th grade, I finally found a therapist that I could really click with and who was going to be able to work with me long term. She really made me look at the world in a different way and also taught me how to use cognitive behavior therapy to really alter my actions or alter my thoughts.
But you see actual changes in the young person's life. They're getting to school on time. They're noticing that they've put more homework assignments in. They've noticed that they have called more friends up to go out. So you see these change in behaviors that had really disappeared. They start getting back to their normal self.
Interpersonal therapy is about relationships and having better relationships with the people that you are close to.
So relationships, people's interactions with one another definitely affect how the brain feels. Interpersonal psychotherapy is a form of psychotherapy where the therapist really will get a general sense of what's going on in your life. Just generally, how do you get along with your parents, how do you get along with your teachers, how about your best friends, how about your girlfriend or boyfriend, and really try to get a sense, is there some underlying or very clear conflict going on in your life? And let's see how these things might be contributing to your depression and your low mood, and if we can try to address some of these interpersonal relationship issues you have, then maybe that will change your depression.
Amelia attended group therapy at an outpatient center after school, where she learned coping skills, which enabled her to come out of her depression.
My IOP, it was sort of like you put all these crazy kids in a room and let them talk to each other under, guidelines of theme and whatnot. But that's really what helped us, what helped me. You can't listen to them. They're your peers. They're even more so your peers than usual because, they understand because they're just like you. They're cutters, they're sad, they're depressed, and they have problems.
Depression is truly, it has biological roots, that the brain is an organ like the rest of the organs in our body, and it can get sick, and it needs help, and it needs treatment. And treatments can be a form of talk therapy, different types of psychotherapy, or for some people, they may need medication treatments, and luckily we have medications that are more, better tolerated now.
With medication, start low and go slow. Start drug treatment with very low doses and gradually increase if needed. Patients need to meet with the psychiatrist more frequently early on when they begin to take medication, so that side effects can be observed and discussed with the doctor.
Some people will experience side effects, so symptoms that they don't feel comfortable with or do not like from the medication, such as they could experience upset stomach, increased number of headaches, diarrhea, and sort of extreme symptoms can be feeling a little more agitated, a little bit uncomfortable if they can't sit still. But that's a little, some people can experience that, but a lot of those side effects.
They did want to, medicate the whole situation, and so my parents were both very against it, and I was against it because it's like, I don't want to be medicated. Then you're thinking, I'm so crazy, I have to take medicine all the time, and that makes it worse in my opinion. You're like, what you think of your condition totally affects it and changes it. So
part of our American culture is to look for the quick fix, a pill, whatever works the fastest. My belief as a clinician is that a problem took many years to develop. You're not going to undo it with a pill or a quick fix.
Often when they've done the psychotherapies and they have failed, and they continue to feel bad, and they continue to feel that their life's not right, and they can't get things done, and school's still going poorly. And I'll get psychotherapists referring to kids saying, look, I've done 5 sessions and we're getting nowhere, and I really think they need the medication for help.
I was seeing these counselors at school and I was seeing therapists, and they decided that it would be time to see a psychiatrist, that it might be helpful, and that getting me on medication might be a good thing. And so they put me on this antidepressant called Celexa, and I only took about 2 doses, and I had a reaction that it was hypomanic. To me, it was an out-of-body experience. That I was just kind of crazy. I felt like I was separated from my body, and it was almost otherworldly. It was really confusing and scary. It started about 2.5 years, just a string of medication after medication, trying to find something that worked. They tried me on everything. Mood stabilizers, antidepressants, anti-anxiety medication. I wanted so desperately to be off the medication, but I knew that without it, I felt so out of control and so lost and scared, and it seemed like the only way that I was going to get relief and that there'd be some hope for me to be normal again. I was hospitalized 4 times during that period. Being in a psychiatric hospital, it's scary.
Where they finally said, we're taking away all the medications and we're going to see what we have. let's see what we have to deal with. And then they found out she was misdiagnosed. And basically 2 years of her life were lost on drugs and in a haze, bouncing between doctors and psychologists and psychiatrists, and everybody going with the prior diagnosis and maybe adding a little bit, or saying, well, you know, maybe this isn't the problem, but they wouldn't change it.
They realized that I didn't need mood stabilizers at all. They just had me on Prozac and Risperdal from that point forward, I believe. Yeah. That was just, after being on 4 or 5 medications at once, I was down to 2, and they were even low doses.
For the right young person, the medication is a real lifesaver and does make a tremendous difference in their lives, so that it doesn't change their brain or their personality to somebody totally else. It makes them who they really are, to get them back to themselves. And I usually recommend for the young person to stay on the medication once we've deemed that it really is necessary, at least 6 months, if not up to a year. You don't have to be on the medicine forever, but we make sure this depression never comes back, and eventually you never have to see me again. And that's sort of the goal for the treatment.
And my mom sat me down, spoke to me, cried with me, and that's what made me think, you know what? I gotta move on to the next day, because I don't want to leave my mother on this earth. You know, leave her. She'll be destroyed, just like I would be destroyed if my mom or my dad left me to take their own life. So I knew that I couldn't do it.
When Amaris's depression reached a critical point where she actually contemplated ending her life, her mother took charge and came up with a solution that fit their financial situations and their feelings about engaging with traditional medical and bureaucratic organizations. They moved to a new, more supportive environment.
Mother decided, you know, we're gonna move away from this environment because it's bringing you down. And that's when I moved to Georgia. I just felt like I had a new, whole entire start in school and everything.
I learned coping skills. That was the big thing that they taught me, just coping skills. I learned to use reading or writing or singing or dancing or talking or listening to music. I learned all these skills that I could use to focus my mind instead of thinking, oh my God, I'm really depressed right now, or oh my God, I'm really angry or sad or upset or miserable or lonely. I learned a way to sort of redirect my thinking.
Through his own drive and desire to break out of the cycle of blues, Vlad pushed himself to join a wrestling team and involve himself in martial arts.
So depression was a big deal for me, but after getting into a team full of kids, like there's no I in team, so everyone has to communicate to each other. So that kind of actually gave me a chance to meet new people and be happier. You know, you can't sit still in one spot and think that everything's going to be okay. You can't. You have to put yourself out there so you can have a little bit of fun.
I got into a program, IOP. It's an intensive outpatient program. And it was a group, and I really loved it there. So that's what, you know, stopped everything. The whole, like, being socially accepted and understood was the whole thing to my happiness and depression.
Get away from me. I want to be alone. Leave me alone. All of that is just like, please help me. Please, I want to be helped. Can you please understand what I'm going through? That's what they're saying. Every time when they say leave you alone, it's please help me. Please stay. Don't leave me. Don't leave me.
If I didn't join anything, I actually think I wouldn't be here right now. I actually think I'd be like 6 feet under. I'm in my 2nd year in college, my 4th semester, and it's going pretty well. My motivation is pretty high.
Today, I am really happy. I am really healthy. I am amazingly strong for everything I've gone through, and proud of where I've come. You know, I went through all of that, and looking back, I can realize, wow, that was a whole lot of stuff that really, it was awful.
I don't think there's any avoiding it. If your child is depressed, they're going to need help, and you're going to go down roads until you're comfortable with someone. And if you don't agree with the doctor, let them know you don't agree. And if you're not comfortable with someone, change.
I think that if I hadn't gone to IOP, I would probably be depressed right now because my life's not particularly interesting right now, but that doesn't bother me. And I mean, I don't let it upset me. And like, if I am upset, people know and they help me.
Every day you don't have to be angry. Find something out of each day that makes you happy. Find something inside yourself that makes you happy. So it's like you're gonna have to deal with it and learn how to love the skin you are in.